Welcome to Dr. O Reacts. On this series of videos, I'm going to be reacting to people talking about health, wellness, aging, hormones. I'm going to be busting up some myths and hopefully giving you guys some good laughs. Check it out.
In our morning rounds, a series of new studies on testosterone therapy for older men find some serious risks and few benefits. The latest research in trials looked at the impact of hormone replacement on the heart, bone density, brain function, and anemia.
So already, I'm probably going to stop this a lot, but I can already tell that the information is going to be skewed kind of negative because they're looking at four factors: heart, bone density, brain function, and anemia. And we know that testosterone can help with a variety of other things outside of these four things, certainly. But all right, let's dig a little bit.
The latest annual sales figures for treatments of low testosterone reached almost $2.5 billion. Our David Agus joins us from Los Angeles. David, good morning.
Good morning, Anthony.
First of all, why has this become such a big business?
Well, we all get older, things start to decline, many of our functions, and we're all looking for that magic elixir. Well, testosterone levels go down.
Okay. Even the way that the question is framed, it's not posed as a health question. There's no information about the fact that testosterone levels have been declining and libido and erectile function in men have been declining over the years, and fertility in men has been declining over the years. The question is posed as a business. Why is this such a big business? So it's not even being looked at as a medical treatment. It's being looked at as a moneymaker, which skews it and it gives it more of a negative connotation. If you were to say, why are men's testosterone so low? Then that's a different question than why is this such a big business?
So this was a potential for an elixir, and there's a lot of marketing done.
Again, even the way he's describing it, an elixir, that's associated with like potion or a trick, not an actual medical treatment that's guided by medical doctors to treat a diagnosable condition. Money-making business, elixir, all these terms, it frames testosterone therapy as kind of a sham.
And people have taken testosterone, and the Institute of Medicine, together with the National Institute of Aging, put together the testosterone trials. I love that title, the testosterone trials, and it looked at the outcome.
Okay, again, even the term testosterone trials, like the first thing I think of is the Salem witch trials. Like we're trying to prove that this quackery or this thing is wrong, like something's on trial, like something is being judged, there's an indictment on something. Again, it's not being looked at from a medical perspective. This is CBS, so it's a nationally, international company. So they're framing testosterone already in this negative light, something that's an elixir, something that needs to be put on trial, something that's a business. It's tricky.
And just yesterday, we announced the outcome on brain function, on heart disease, on bone, and anemia. And so it's very important that we have data, and these were randomized clinical trials where men either got a patch with testosterone or a patch with placebo and were followed for a year.
So what were the results, Dr. David?
Okay, so big issue with this study already. The guys were given a patch, and as we know, the delivery system of testosterone is very important, and the patch is on the lower end of efficacy. We know that injections of testosterone or testosterone pellets yield better results than a patch. So already the positive benefits of testosterone are not going to be as good as they could be if the delivery system was a lot better. So let's hear the results. I wonder what they could be.
Well, the results, envelope please,
yes,
showed that in pretty dramatic fashion that if you followed them for a year, the amount of heart disease, that is soft plaque in the arteries of the heart, went up over a year. At the same time, cognitive function, memory, no change at all. And when you looked at anemia and bone density, both of those improved. So somewhat mixed results, but obviously we get worried, especially on the heart disease.
Okay, so again, with the study from the previous, like a few seconds ago, they showed it was 788 men. There was no information given about their prior health status. There was no information given about the amount of, maybe they'll do it later, but probably not. The amount of testosterone that they were given, their prior disease status, how much they were exercising. So there's no information given about that. I'm sure, they'll leave the notes of the study at the end of the clip, but to the general public, no one's going to go back and look at that. They're looking at CBS this morning as their authority. And, the doctor here is talking and he's giving some authoritative statements. And the very first thing he says is, heart disease went up. But we have to look at that more deeply. These men were 65 years old, and we don't know their prior health status. And we know the risk for heart disease goes up as you age. But the way that it's being framed, one would think, if I get on testosterone, my risk for heart disease goes up. And that might be true if you're not being managed properly, but it's just the information isn't being framed correctly. It's kind of making a direct one-to-one correlation. These guys were on T and their risk for heart disease went up. But any good medical professional or scientist knows you have to look at the background data. What were these men's health status before they got on testosterone? And they're already above age 65. And we know that heart disease is the #1 killer of people, and it disproportionately affects older people who have a poor health status. And we don't have any of that information from these guys. So again, a bit misleading.
So, Dr. Agus, I watch a lot of sports, and you can't watch a lot of sports without seeing low T ads all the time.
Yeah.
Is there a natural way to increase your testosterone?
No question about it. It's called losing weight. So, as you get larger, testosterone goes down. So the more we exercise.
Let me go back and make sure. She asked if there's a natural way to increase testosterone. Let me go back and make sure before I get too rowdy.
To increase your testosterone.
Let's go back.
No T ads all the time.
Yeah.
Is there a natural way to increase your testosterone?
No question about it. It's called losing weight.
Yeah, so that's incorrect. Losing weight does not increase your testosterone. We have a video about that. You can go back and see. But losing weight does not increase your testosterone. If you have a more ideal body composition, if you're not overweight or obese, if you don't have a lot of central adiposity, the chances or the rate at which your testosterone declines as you get older may be slower, but there's no natural way to increase testosterone. He's essentially saying that, there's no way that if your testosterone is at 300 and you lose 50 pounds, it's going to jump up to 600 or 700. That's terribly misleading. But you can put it under the umbrella of if you're healthy, if you have more of an ideal body composition, if you're eating right, if your stress levels are low, the rate at which your testosterone declines slows down, but losing weight does not increase testosterone. That's totally false.
The more we keep lean body mass, the better our testosterone is going to be over time. There's no magic food. There's no magic supplement. The key is just hard work, exercise, and moving around.
Again, that's not necessarily true. It is true that people who are obese and have a lot of central adiposity or a lot of fat around the abdomen, they tend to have lower levels of testosterone. But again, it's not a one-to-one correlation. As you get larger, your testosterone levels go down. In general, I think it's safe to make that statement, but that's not always true. And he's just making it sound really definitive. If you lose weight, your testosterone increases, which is not true. And if you get bigger, your testosterone will decrease. It's not true. And before I stopped it, he's talking about the other ancillary things you can do, which are super important. Exercise, stress, communication, having good, healthy relationships. Those can help with testosterone. But again, losing weight doesn't increase your testosterone. And because you get larger, that does not directly correlate to having lower testosterone.
So, David, are you saying that basically testosterone replacements are with the risks, a bad idea?
Well, I think that the data show that in people with low testosterone, taking testosterone don't affect cognitive function, have a minimal short-term effect on sexual potency, not nearly as good as the Viagras or Cialises of the world, can increase heart disease. And so when you look at all of those in total, it certainly pushes against taking testosterone for low T.
And men looking for the fountain of youth, I know a couple of those guys.
Ain't nothing wrong with that.
Okay, so he's saying that if you take testosterone, you increase your risk for heart disease. It has minimal effect on sexual function, not as good as Viagra or Cialis, and has some effect on anemia and bone density, I think he said. Again, not taking into account the delivery system. That's like saying exercise isn't effective, but the only type of exercise you do is getting up and going to the bathroom. Like, you are moving your body. That is a form of movement and exercise, but it's not the most efficacious form. So it's like throwing out the baby with the bathwater, as they say. We're giving testosterone in this form that's not the most efficacious. It's not the form that'll give you the best bang for your buck. And because we're given in this poor form, we're throwing out the whole entire entire treatment system. That's not true. You can raise testosterone levels with injections and with pellets. And again, we don't have the background information. We don't know how much testosterone was given to these men. We don't know their previous health status. It's just a really sweeping, broad conclusion that's being made here. And I think it's kind of dissuading people from testosterone without having all the information.
And
everybody's looking for the fountain of youth.
No, but does it help? Does testosterone help, David?
No, testosterone doesn't help with the fat in you, but exercise,
Yes.
diet,
Yes.
all the things we know about
Low
certainly
stress.
benefit.
All the
right.
magic.
Nothing wrong with a little pot belly. Thank you, Dr. David. It's good to see you.
Okay, at the end there, she's asking about the fountain of youth, and he's like, no, it doesn't help with the fountain of youth, but there's no definition on what the fountain of youth is. I'm assuming he's talking about sexual function, and we know that testosterone can improve that, but again, just a kind of nebulous term that testosterone doesn't help with. Overall, I would give this video a failing grade. I would give it a D with regard to transparency. I would give it a D with regard to information, like truthful information. So overall, this video fails. I think it's skewed. It's trying to put across a certain message about testosterone. So overall, Dr. O's grade for this video is a D. Testosterone does help with anemia and bone density and brain function, and there are some studies that show that testosterone actually improves heart disease. There are studies that show over time that lower levels of testosterone actually increase your risk of heart disease. So I'm going to try to find some more videos on CBS, because this was in 2013. So maybe we can do a chronology. Let's see if their attitudes and their information has changed over time. But Dr. O's grade for this video is a D.